wake up at 3 o'clock in the morning. So that's not good for you either. Alcohol-induced sleep is not great.
Could you elaborate a little bit further on that? I mean, I think that most of us have read the nightmare stories about people doing weird things in the plane, or is it an acute issue only, or is it also a long-term effect?
Yeah, that's a really good question. I don't know if there's any literature out there for its effect on long-term in terms of cognition. But yes, the reason these people are doing this is because it's altering their what's called REM sleep behavior. It's actually altering the connection during that period of time so that people do some crazy stuff. They actually are technically asleep, and you're not going to do something you wouldn't do. It's just like sleepwalking. You wouldn't do something you wouldn't do otherwise, but you'll do some pretty weird stuff. Like make phone calls and yell at your boss or something like that. That's why I don't like ambient, because it's fundamentally disrupting the sleep architecture in a way that's not healthy. And so I think it's great. So many people swear by it to get them to sleep, or a lot of people talk about when they're on flights, and traveling across time zone, they want to take that because they can get themselves situated, on the time zone. Melatonin is a natural modulator of sleep. It works for, about 10-15% of the population. If melatonin works for you, that's great. Just make sure you take it 3 hours before you want to go to bed. You don't want to go not at 10 o'clock at night, because it's not going to have an effect right away. And 9 milligrams. A lot of people take just the 3 milligram dose. You really need 9 or 10 milligrams to make it effective.
What's your best story of somebody who has reversed or partially reversed dementia?
Stop taking drugs that are bad for you.
How about, have you seen it happen with the other?
No. What I will say is I've had more than one Alzheimer's patient who has been a very active person, and their course was shallower. So they didn't progress quite as rapidly. Right off the top of my head, I can think of a guy that I liked. He was completely amnestic. He couldn't remember what day it was, okay, for 6-8 years. And he was an avid tennis player. And then he crashed. But, he did very well. And so I think what I encourage people to do is exercise. I think that's the one thing we can say probably helps them modify that. But most of the people who, quote, reverse either have, there are some rare reversible dementia disorders like autoimmune thyroiditis, which occasionally about 1 in 5,000 people actually have cognitive symptoms. Normal pressure hydrocephalus, usually it's a short-term response and then you go on to dementia. But those are the ones I've had the most success with. And then there are the people who are on a slew of drugs, and the ones that I see are the most problematic are those who are on pain medications and multiple antidepressants.
Multiple what?
Antidepressants. I find my greatest successes sometimes just cleaning these people up from the medication. It can be arduous, but it's worthwhile.
We have a question over here.
Any data on coffee and Alzheimer's?
Yes. Yes. You can't drink enough.
And how about tea? Is coffee and tea equal?
No. Coffee. The problem with coffee, if you're like me, is that you drink coffee and you don't eat, and then you burn a hole in your throat or your stomach. But you cannot drink enough coffee. There is no upper limit so far. And you think, this is so interesting, because I'll wake up and my systolic blood pressure will be somewhere around 116 or something like that. I'll have 3 cups of coffee and I'm seeing about 130. I feel fine. I'm hypertensive. I don't know. I like coffee though. And no, the data is really, it's very real. Coffee is good for you. Chocolate is very good for you. And as you know, UC Davis was the first to identify that chocolate was good at reducing cardiovascular disease. So, you know, I think we all should be Swiss. Or is it Swiss or is it the Belgians? Belgians, right. So when you get a cup of coffee in Belgium, there's a little chocolate next to it. And so that's, man, go for it. And I would say, if you're going to eat chocolate, you do want to do dark chocolate. The milk chocolate is got a lot more sugar in it. Yes. Yes.
See, maybe this is just my own personal experience, and my wife's as well, but it was just because I'm old now, but drink caffeine late in the day, chocolatey dessert, can't sleep.
Yeah.
So it's almost like, okay, now which way do I go?
Right. I would say that there are some people who can sleep and in fact, my father-in-law, he can have a cup of coffee 30 minutes before he goes to sleep, and he can sleep fine. I would say that most of us can't have coffee after 1 or 2 o'clock in the afternoon, and that would be what I would encourage you. Interestingly, that the caffeine in chocolate, for whatever reason, whether it's an absorption thing or what, it doesn't quite do the peak effect that coffee does. So I don't exactly understand that, but it probably has to do with either the amount of caffeine that's in the chocolate. And if you like coffee, the darker the roast, the less the caffeine. So drink dark roast coffee.
What about decaf, just while we finish that? Is there an association with decaf and?
You know, I don't know. I think the caffeinated, the coffee data that I saw was caffeinated. I don't know if they looked at just drinking decaf. I'm always a little concerned because how do they get the caffeine out of that, right? I think they steam it or something. I don't know.
Yeah.
They do something weird to it. They probably soak it in acetone or something like that. You're all gonna die.
Hi, Dr. DeCarli, Martha Garrity. I used to do your translational research over the Alzheimer's disease some years ago. I work for HealthNet right now, and we work with a lot of Medi-Cal population. Right?
Yeah.
And I wanted you to address kind of the earlier question, social determinants of health. What studies have been done looking at things like education and diverse populations and financial security and poverty and food insecurity, things like that related to Alzheimer's. And I know the SALSA program was one of the big ones, and I wanted you to address that because many people in the room probably don't know about that study that UCB did years ago.
That was Mary Hahn's study.
And I worked with Mary.
Yeah. And so I'm part of the HCHS SOUL, which is a much bigger study. The simplest answer to this is that I would really love to take a quarter of the Pentagon's budget and pay teachers and change the living environments in many of our neighborhoods, and we can do it pretty easily. The biggest mistake that we make as a society is to not value early life determinants of health. They carry through your entire life. And it's probably, you know, and fortunately it's tied to discrimination, it's tied to all kinds of things, right? But those early life determinants are critical because that's where the brain is forming. So, and it's not just whether you get to 12th grade or you get a college education. It's the quality of education that also changes how your brain responds to your life. And in the United States, in particular, there's such a close link between good education and financial outcome and health outcome. It just cannot be minimized. And there are cases in which that's not true. There are people, you know, entrepreneurial folks that come and do very successful, but by and large, as a population, good education leads to good jobs, leads to good health. Those things are really linked. And there's good evidence that your brain follows that course. And that's why I showed you in this, let's see, where did it go? This big thing about, yeah, this, right? You know, what do we want to do? We want, oh, I should have done this the whole time. Jeez Louise, Mother Mary. What we want to do is we want to make this arc really high, right? Okay, we want to make this arc really high. And we also want to change this.
How do you make the arc high?
You pay teachers $100,000 a year. You restore our public education system. You make sure that kids aren't food illiterate and food deprived. You encourage reading at home. In some communities, you can ask the children, when did mom or dad read to you? And they will look at you like, what? Parents don't read to me. And these are fundamental changes that we could make in our society that would change how we are, how our children grow up and how good their brains are.
So talk more about creating that healthy brain. So you're saying the education is stimulating the brain and making it
Yes.
bigger.
Yes.
And also exercise is giving it greater blood flow. How is that, what is the exercise relationship where you're seeing
So the exercise relationship is that, so I would say there's two parts to that point, is that what you want to do is develop the biggest brain possible, okay? Right? And for those of you who are familiar with this, I mean, one example of how good the brain is that how many times do you have to teach your children to talk? You don't teach your children to talk. They just absorb it, right? They learn language automatically, and in fact, given the opportunity, they will learn 2, 3 languages. And in fact, again, the Dutch are a funny group, but they learn, on average, 3 to 4 languages through their school education, okay? That's making your brain is plastic at that point. It wants to grow. It wants to absorb new information. It wants to make unique connections. That then makes the foundation of your brain. After that, you need to maintain your brain. And you can do that through exercise, diet, controlling your blood pressure, all these other things, okay? But if you don't give the brain a good start, okay, then you have problems. And there are, there's perfect examples of how this, there's a case of a young lady who was locked in the closet and was just passed food and never learned to talk. Never learned to talk. They found her about age 15, couldn't talk. They tried to encourage her to get language, could never do it. So why do I say that? I'm saying this because the brain has a time. There's a time in which it's really ready to take new information and grow. After you get past that certain level of time, it's a lot harder. Not to say you can't learn. We just learn differently.
So can you talk a little bit about activities you can do, say, after the average age of everyone in this room, other than my students, to keep their brains healthy from an intellectual standpoint, singing complex music, learning a new language, all those sorts of things,
Right.
dancing.
Anything that's hard. Okay? So you do Sudoku 3 times. Is that how you say it? Sudoku. Or Sudoku. Whatever. Okay. You do it 3 times. Okay? You do it maybe 20 times. The learning's done. After that, it's just entertainment. Okay? Things that require lots of in-depth, like learning a new language, like picking up the piano or learning to play music when you did it. Those are the kind of anything that stretches your brain. And but dancing is a whole other thing. That's great for the axial nervous system, and that's great for frailty. So I encourage all of you to dance. And even people with Parkinson's disease who have problems, dancing helps them too. So dancing is great, particularly formal dancing where you have to hold the frame. So ballroom dancing, that's kind of cool. And exercise. I'd say if you're going to get one take-home message, exercise.
And can you be specific about the exercise, other than walking a little bit? I mean, what's ideal? What's ideal? Is it strength training plus?
Oh yeah, that's a really good point. I would say you want to do core exercises so that your musculoskeletal system is
Planks.
sure. But the most helpful is any cardiovascular, and the trick is to get yourself up to a fairly decent heart rate.
Meaning what?
Well, it depends on how much you do it. I wouldn't take somebody who's sedentary, diabetic, hypertensive, and say, I want you to get your heart rate up to 150. I'm not sure they can even do it. So it depends. The more athletic you are, the higher the heart rate should go. When I'm exercising, I'm often around 160. So I'm about 20 points over my ideal heart rate.
I think we should all really listen to what he just said. So all of our trainers, all of our physicians, all of our coaches are telling us something different than the big brain expert here. So
so they don't want you to die either, right? I mean, so let's be clear on that. Everyone gets to their own, what I would consider their own exercise tolerance, okay? So if I'm at 95 and I'm huffing and puffing, that's it. If I'm at 150 and I can't tell I'm exercising, that's different, okay? I mean, so you have to be careful, right? And the biggest cause of acute myocardial infarction, or cardiologist, is people who have poor exercise tolerance, and they go out in the frickin' snow, and they start plowing, and they do all this extra work, and then boom, they drop dead. That is actually a very common cause of sudden death. People who haven't been exercising suddenly exert themselves. And the best thing you can do is scale up your exertion so that you are at 150 and not breathing too heavily and can sustain it for 20 minutes.
And ideally, we've had a Stanford cardiologist tell us 30 minutes aerobic exercise every day.
Too much.
Why is it too much? So there's such a dissonance here.
No, not too much. So, look, let me just say this. How would you feel if I said, everybody in this room would be happy if they only earned $5 million a year? Okay? That's what this guy is saying. Okay? He's saying, yeah, you'd be in great shape if you did 30 minutes of high-impact exercise. But I'm saying, look, if you're doing moderate exercise regularly, that's okay too. Right? I bet he doesn't do 30 minutes of exercise every day. I bet he cheats. So many people do. So this is a great story. A friend of mine who does non-invasive monitoring. He had people come in and he had them on monitoring heart rate and movement. And basically asked them, okay, you've been wearing this actigraph for a week. How much exercise did you do? How many hours did you do exercise? How many minutes did you do? Was it vigorous or not? You know what the correlation was? Almost zero. People's perceptions of their own exercise are wickedly distorted.
I don't know how many of you were here for Dr. Salas, who came last fall and spoke on moderation and how much of a difference it made in that initial going from being a complete couch potato to getting up and walking. that's where the biggest delta was. That's where the biggest impact was. And I thought it was interesting when we talk about moderation. You look at those scores on the 7, that were above 0 to 6 and then 7 to 8. There's a huge change from that 0 to 6 to 7 to 8. And then you got all the way up to 14 and higher. It wasn't quite as much change. It's great. But to emphasize to people they don't have to be perfect and you're going to have a huge impact was the message. And I appreciated that.
Yeah, it's really the people in the lowest, it's the bottom 30% of the healthy people that explain about 90% of the problems. And then if you can just move them from the bottom third to the middle third, you could have a big impact. But if you ask them to start running 4 miles a day, yeah, not going to happen, Not going to happen. And actually, that takes me 40 minutes.
So from a practical standpoint for the health systems, what difference does the control of blood pressure, blood sugar, and cholesterol make for the future of the patients becoming cognitively impaired?
Huge. That's what I would say. You said huge. And I don't have it in this slide deck, but I have another slide deck where we actually, are you all familiar with Sprint Mind or Sprint, the Sprint trial?
Yeah.
Yeah, so they terminated the Sprint trial at 3.5 years because the effect size was so huge, right, in favor of aggressive blood pressure treatment. What they did then is they continued to observe these people, and they asked a simple question, what's their cognitive outcomes, right? And what did they find is that 5 years later, 5-6 years later, you start to see a real divergence, okay? And so what we need to communicate to our population is do this, you're not going to feel good about it now, you're not going to feel anything now, but you will be a much happier person in the future. Now, that's a real hard thing to communicate to people who aren't getting by day to day and who are actually at the greatest risk for all of these others. So, again, we have to focus on those people who are at the highest risk and make those small changes possible. Everybody else, just encourage them to say, change the way you do things, follow the Life Simple 7 or what you all are doing right now, and it will have a payoff. It'll have a huge payoff. It just won't be tomorrow. It works if you work it because you're worth it. Every one of you are worth it.
Do you think the current 30% or 35% that the literature suggests of dementia, that it is preventable, do you think that that parallels the cardiovascular literature where we underestimated it for decades until we have the data? Because we're now currently thinking 90% of heart disease by inner heart is preventable. From what I hear you say today, it sounds like you think most of dementia is preventable.
Well, we just don't have enough data out there, right? The more we look into this, I would say that the way I think about it is that cardiovascular risks doubles your lifetime risk for dementia. So however that impacts our society, that's probably about right. So it's the same level at which major genetic risk factors are. So it's up there. It's up there. I don't know that you could get rid of Alzheimer's disease if you had perfectly good cardiovascular health. But it may be that you reduce the impact of Alzheimer's disease if you have good cardiovascular health. And that's the argument I'm making in this one.
So we had a presentation on November 18th with the...
You're killing the audience, you know.
Well, they're used to this. They come back.
I am so sorry.
Dr. DeCarli.
I'm kind of tired. How about you?
These people have been coming back here month after month, 10 months a year, for now 8 years. Month after month.
God bless
So
you.
thank you and God bless you. And these are the people who spread
Okay,
these
ask the
best practices.
question. So, yes.
So one of our presentations was on the blue zones.
Yes.
And many of us are very excited about changing the environment and our cultural habits to make it easier for people to be healthy.
Yes.
So one of the blue zones is right here in California, in Loma Linda, where
Right.
Joe Skye went to medical school. And I'm just wondering if you see anything in the Framingham data, the Loma Linda data, around a plant-based diet. I know you talked about the mind diet. You
Yeah,
talked
the
about
plant-based diets are really important, okay? They really are. So there's a couple of things that I want to say to this. The first thing I want you all to hear is the number of years you're on this planet does not necessarily translate into quality of life, okay? So I'm doing 2 studies of people over the age of 90, and some of them are really struggling. They're alive, okay? You'd say, oh, you got to 93, great. No, they're not. Okay, so that's number one. So we're so competitive as Americans. We're so competitive. We just want to keep pushing that number, and it's good, but I think you got to talk about quality of life. What makes Blue Zones unique, I think, is whatever social structure is going on, whatever lifestyles, whatever it is, because the actual amount of disease that they have is not drastically reduced compared to everybody else. Okay? It's not like people living in the blue zone don't have any hypertension. The consequences seem to be different. Why? I don't know. Okay? There could be some genetic risk, but in Loma Linda it's probably not. It's a pretty diverse community, even though their cultural background is a little bit more influenced by a single process. So I don't know. I think there's a lot of things going on. There certainly is some genetic influence. So if you're 85 years old and you're a man, if you're over age 85 and you're male, you are somewhat different than every other male who didn't make it to 85. And what we see in the 90 plus and people is that they just seem to not carry some of these major diseases with them. Okay? So you don't see 96-year-olds who are ambulating normally who have 40 years of diabetes, things like that. They just don't carry. So there's a sort of a rollover phenomenon. Why that is, we don't know. But there's some kind of really strong, and we call that cohort effect in Framingham. There's a huge cohort effect. So the people who get to 90 and you're examining them are going to be very different than the people who are 60 in your cohort, even if they lived in the same place. There's something selection bias about that. So I can't tell you, but I do know that there are social cultural effects that change not necessarily get rid of the diseases, but change the impact of the diseases on the body. Don't know why. So if you have a magic elixir that's called Blue Zone, I'll drink it.
Were you raising your hand or were you just
Yawning?
otherwise gesturing?
Well, now that you mention it, I just have I read an interesting article about, they did a comparison between folks that were taking antidepressants that had a high affinity for serotonin reuptake. It lowered their ischemic stroke risk substantially compared to patients that weren't. And I thought it was very interesting because you had mentioned earlier that that folks that are on these multiple medications can, have issues. So.
Yeah, I think this is one of the things that we're getting to with precision medicine. There may be some genetic background in those folks that makes them uniquely benefit from the drugs uniquely, whereas other folks, it's not so good. And so I think this is going to be like cancer, where we start to move across, quote, diseases, when in fact they have they have a mechanism that's shared across different exposures. And so or phenotypes, clinical phenotype. So, nowadays when we think about breast cancer, it's not necessarily because it's in the breast. So I don't know. Yeah, those are interesting phenomena. Can I go now?